Good afternoon and welcome to this month's show. I'm Luke McCormack. During today's show, we will discuss critical issues facing government and industry leaders in using information technology to improve healthcare and healthcare services. With me on today's show are Mark Vafiades, Senior Advisor, Office of the National Coordinator for Health IT at the Department of Health and Human Services, Jose Arrieta, Chief Information Officer, Department of Health and Human Services, Shermender Paul, Chief Data Officer, Department of Veterans Affairs, Bill Tinston, Program Executive Officer, Defense Healthcare Management Systems, John Harris, Director of Federal Mobility Solutions, Verizon Public Sector, Cara Edwards, ServiceNow Healthcare Solution Consultant, and Ben Cushing, Director of Emerging Technologies at Red Hat. Well, this is certainly a very important subject for a lot of people. It's certainly very timely. We have a great mix of departments and agencies and partners here with us today, and a variety of roles that each of you are holding. So this should be just an absolutely fantastic conversation. Mark, let's start with you. Give us a state of the program that you're involved with there at Health and Human Services.
Thank you, Luke. First of all, one of the things we've been working on for the past few years, and we're really finishing up, and that is the implementation of provisions of the 21st Century Cures Act, which was passed almost unanimously in 2016 and signed into law. And two of the provisions that we're really working on that we think are transformative for the healthcare system are interoperability and patient access. So let me just start real quickly with interoperability. That is the ability for providers and healthcare organizations to share medical record information, healthcare information on their patients with others. And that has not been the case previously. If you're seeing one doctor that isn't necessarily connected in the same organization as another provider, then they're not necessarily sharing information. So you could go to a doctor, you could have some lab tests and so forth, and then go to a second provider, a second doctor, and they're asking you about maybe those lab results because they don't have them. They may even give you a second test, something you had last week, which not only is costly, but it's just a lot of trouble. So again, this will allow and require health organizations and providers to share all your healthcare information with one another. Patient access, that's the second major part of this, and that allows the patients to be in control of their own healthcare information. And the provision requires that there will be application programming interfaces, which basically is the gateway to information on each provider's portal that will allow a smartphone app to go to that portal, collect that information, and bring it back to your smartphone. And those smartphone apps will be for the patients at no charge. So you will be able to see everything that's going on with your health, your lab tests, your conditions, your previous appointments, your after visit summaries, and so forth. So again, this is transformative, and it also kind of puts competition back into the healthcare market, which has been missing for a long time, in that when you see all that information, including pricing information, you'll be able to shop for care.
Wow, that's fantastic, and it sounds like it sounds incredible, and something that every American that can certainly enjoy. But it certainly sounds daunting to be able to implement that. Let me go over to Jose, because it sounds like you'll have to get involved with the implementation of something like that, and certainly do it securely, and all these other things that have to be thought about when implementing a system across the country like that.
Yeah, I mean, so first of all, it is an unbelievable goal. I think I'll talk about something that we've built since April 5th. And so as it relates to the coronavirus response, and I think it dovetails nicely into Mark's comments. And one of the challenges we have across the United States in responding to this pandemic is a lack of visibility into and a common operating picture in terms of what's happening on the ground across the US. And so on April 5th, we were given a proof of concept that was a very small proof of concept that was invested in by CDC. And we've gone forth and actually built something that we call HHS Protect. We launched it on April 10th. HHS Protect is focused on protecting people protecting transparency, protecting privacy, protecting security, and finally protecting integrity and data sharing. The platform itself, by April 28th, we had 2.5 billion data elements in it. We had data that we're receiving data from all 50 states and all 6 territories. We're sharing data with all 50 states and all 6 territories. We currently have about 4 billion data elements in it. The data elements include data directly submitted to us from around 5,800 hospitals across the United States, all of the single sources of truth for case reporting. And we have a diagnostic dashboard, and we have almost all the lab testing that exists across the United States, direct interface, daily feeds into it. And we can look at a common operating picture across the United States as it relates to coronavirus at the federal level, at the state level, at the county level, and at the zip code level. We can get an understanding how the virus itself is impacting different people. Now, our approach, and I'm going to tie it back to kind of what Mark said, our approach has been to actually take commercial technologies, Luke, and instead of hiring an integrator, actually be the integrator and integrate those technologies to deliver the solution. So we have a modern identity access management capability. We have a modern secure file transfer capability. We have a platform that allows for parsing, curation, and sharing with integrity. It's underlined by a hash. It has a time series capability. So when we opened it up to states and one of the states mentioned that we were manipulating numbers, I went back in time through my immutable hash and I said, it looks like you guys actually submitted the same data set twice within 2 minutes and you backdated one of them. Not sure why you did that, but this is immutable. This is the single source of truth. We're running, we overlaid it with mapping technology and ability to sign and agree to digital agreements. We have about 20 DUAs with private sector commercial companies that are providing insights on the medical distribution network as it relates to coronavirus across the United States. We're running a supervised machine learning capability off the 4 billion data elements to actually predict hotspot outbreaks across the United States so that we can run clinical trials more efficiently, to distribute remdesivir across the United States to help the American people, and to distribute lab testing across the United States. So we put that in place, started on April 10th. The numbers I just gave you is where we are at this time. One of the things that we did recently within the last 2 weeks to kind of get to Mark's point is we actually stood up a public-private key infrastructure. And what we've done is we've created the ability for an organization like a company to have a digital identity, government to have a digital identity, an endpoint, whether it's a sensor or a machine, think of an over-the-counter COVID-19 test at CVS, to actually have a digital identity so that we can build an application ecosystem leveraging the data in HHS Protect and leveraging the test results so that an individual consumer can actually keep their test result on their phone, time-stamped, anonymized, in an immutable way, updated at the federal, state level, directly from an over-the-counter CVS test, and then use the data in HHS Protect. So when they're driving down I-95, they can figure out where they should stop to go to the bathroom based on case counts, based on zip codes, based on a live stream API of that data. We think that modernizes the healthcare industry. We think this pandemic in and of itself is a fundamental shift for the industry. Why? We need 1.5 million people are going to have to enroll in clinical trials. We have a clinical registry. We have about 500,000 people signed up. We need people to register for vaccines. We probably are going to have to vaccinate 330 million people. If only half of them actually choose to get the vaccination, you've just created a digital identity for 170 million people across the United States and given them the ability to store the record of their vaccination on a mobile device.
Pretty incredible situation there and a daunting task. I love the Lego block sort of approach to building on this environment so that you can provide that capability across the entire country, quite frankly. That's super impressive. Shamendra, let's go over to you at VA. You've been over there for a little while now as the Chief Data Officer, and we all know a lot of this is about the data and making sure we have accurate data and making sure we can identify it, index it, et cetera. Give us a state of the status to what's happening over there at VA as you've entered onto the scene.
Thanks, Luke. I will, and appreciate being on the show. And I really want to riff on what Jose and Mark mentioned earlier. Jose is a great partner over at HHS. We're also building a common operating platform, leveraging some of the lessons learned and working out appropriate sharing of data. We report into HHS Protect, our testing. I think all of you know, but maybe the audience may not know, VA runs the largest integrated healthcare system in the United States. So in that role, we're reporting into Protect Now as we're building out a common operating picture to help the executives in headquarters and in the field with the integrated networks, with the medical centers out in the country to better align decision making and support our veterans, and to help us execute our fourth mission of helping to backstop the U.S. healthcare system in this time of pandemic. Also coming back to what Mark was saying about interoperability, access, APIs, aligning with standards-based approaches. We're all in on that, and VA kind of sees ourselves as a key test bed, a key partner for the national coordinator. We've been a leader in doing health information exchanges and things like that. The Blue Button work, for example, started at VA, now has migrated over to CMS. Something I want to highlight, though, is the policy framework. I came in, like you said, about 11 months ago. Been doing a lot of work with partners inside of VA. What's interesting is that CDOs are in all different parts of organizations. Jose is the CIO, he's also the Chief Data Officer. At VA, I'm not in the Office of the Information and Technology. I'm in the Office of Enterprise Integration, which has an internal integrative policy governance function across all of VA. I partner closely with the CTO, Charles Worthington, and somebody in a new role, a Chief Data Technology Officer, Denise Kitts. We work with the CIO, with the executives and the different operating components within VA to drive an integrated data strategy using a data governance council. Some specific examples. I talked about the common operating picture. We're building that to help us improve our response on the COVID-19. Telemedicine is another area. We've been a leader in telemedicine, but over the time of the pandemic, that's just gone off the charts in terms of how much of our service delivery to veterans has been done through telemedicine, tele-ICU, things like that. We're also kind of at the cutting edge of disease modeling. The national surveillance tool. We've developed epidemiological models of COVID-19 and how it manifests. We use natural language processing on the clinical notes in our electronic health record system to be able to generate that signal to allow us to understand the patient journey, inpatient and outpatient, for the veterans we serve predominantly through the Veterans Health Administration. So a variety of different aspects. And, while data has been a strategic asset in VA for some time, the push now is with the Foundations of Evidence-Based Policymaking Act, the Federal Data Strategy, to really take that to the next level. And there's a lot of energy behind.
Using the data and the use of this technology, and particularly this modern technology that's being introduced, it's just incredible how we can really attack this pandemic. It's awesome to see this. Bill, how about over at Defense Healthcare? And why don't you give us a minute on sort of, what is the role of, people think about DOD and the EHRs there, and then I think about, VA and what they're doing and interfacing, and maybe a quick 101 on what is all that, and then what's your role in implementing all this?
Well, so what we're doing, and actually, I think it was interesting listening to Mark, Jose, and Shamander. It was almost like being at a staff meeting this morning, the topics that they covered. So what we do at PEO DHMS is Defense Healthcare Management Systems, is we're charged with being the DoD provider of health IT. Originally, the new EHR, electronic health record, called MHS Genesis. There's an operational medicine role and a data accessibility role as well. But what's been going on the last year is pretty exciting, and that is taking what we're doing with what in DoD we call MHS Genesis, and working with the VA and working with the Coast Guard, and making it, and going beyond Mark's comments about interoperability, at least within the federal healthcare providers, and making it a common record, not an interoperable record, but a single record, a common record about the patient, not where the care was delivered or who delivered the care. And we're making great progress on that. This month, the Coast Guard goes live with their initial sites, their initial wave. In the very near future, the VA is going to go live, and DoD has 8 sites live at this point, and continue, and has a schedule that takes us through 2023, delivering a modern EHR to the military health system. but it's a single record about the patient and not where the care is delivered. It's very, very exciting. And then the other thing Mark talked about, he talked about access to your own record, but it's more than that from a data perspective. I had another program, it was the operational medicine program, and going through the response to the COVID experience, it has proven to me, and I think this was covered a little bit, or at least touched on by some of the folks before me, but it's not about operational medicine, right? What we viewed in DoD as operational medicine, which is delivering the data about the right patient to the right provider at the right time, based on the characteristics of the care that needs to be delivered and the technical characteristics of the environment. We thought of that as operational medicine. So it gets the common operating picture, right? We all talked about common operating picture. We also have common operating picture efforts underway domestically, but we were able to capture what we were doing with the operational medicine capabilities and bring it domestically and apply it to the COVID situation, and then look at how do we extend this? And as we're looking at this, how do we extend this across non-traditional healthcare delivery environments, the capabilities that we already have, and how do we extend them? So that's what we're doing, and that's telemedicine. Shamander mentioned telemedicine and what the VA has accomplished there. And from a DoD perspective, and this joint federal approach to providing the electronic health record, DoD is leaning into what the VA has done and the success they've achieved there, and trying to adopt the same set of tools to extend the clinical workflows that we create through MHS Genesis to different environments and non-traditional environments.
Absolutely fantastic news there, and I'm sure that every warfighter in the DoD is happy to hear that. John, we can't do this without good connectivity and being able to stitch all this together, telemedicine, et cetera. Where does Verizon public sector fit into an ecosystem like this?
Yeah, thanks again, Luke, for having me. And I think it's a great question. You know, today's environment has put a lot of resiliency and dependency on remote networks. And so, as Verizon, I think we're excited and eager to participate and help to fuel the telehealth and interoperability that some of the folks you've heard talk already have mentioned. So, you know, we're doing a lot of work to expand 5G. I'm sure you've been reading a lot about that recently. But you know, finding ways to provide additional bandwidth, lower latency, and really push new and innovative use cases to our end users. You know, Verizon, we're obviously, you know, concerned today about caring for our employees and certainly, you know, caring for their safety, but then finding ways to leverage technology to innovate and fuel telehealth and keep people maybe out of large healthcare facilities if they need to be isolated and need to be in a safer environment is critical. So recently we just launched our 5G mobile edge compute platform. It's a partnership with AWS. It's called Wavelength. And so finding ways to push compute power to the edge, higher powered applications that can now be delivered outside of a heavy data center. Can really help enable, you know, remote solutions. I wanted to call out Shaminder and his team at the VA. You know, we've been working a lot with folks at Palo Alto on a 5G pilot, where we have partners like Medivis who have been working to really discover and innovate how we can leverage something like 5G to provide better care for patients. So imagine, you know, a world where instead of looking, you know, a doctor looking at a 2D sort of MRI, you know, image on a screen and then trying to turn to a patient and enable or you know, translate that in their mind, you know, where is the issue? What's happening with this patient? Now we can potentially have a VR or AR situation where the doctor can look at the patient and lay the MRI image right on top of the patient and be much more accurate in how we deliver care and services. So, you know, some really, really innovative stuff that's happening, some really, you know, I think exciting things that Verizon can do to help enable a lot of these services at the edge. And that's sort of on the, you know, the cutting edge. We're also doing things just sort of day to day by enabling, you know, mobile EHR access and you know, providing, as Jose mentioned, you know, access to applications when people are up and down I-95 and delivering that information in a secure and reliable way. is critical. So this has presented a lot of new challenges and a lot of new opportunities, and we're excited to leverage the Verizon network and help to deliver for our partners and their missions.
Fantastic, great technology and coming at a very important time. We're going to take a short break and we'll be right back. You're listening to the Federal Executive Forum on the Federal News Network.